Pain assessment and management enhances healing and promotes physical and emotional wellness. In EBGH, per policy, patients' right to pain management is respected and supported by healthcare team. Pain assessment is completed during initial clinical assessment and in all disciplines. The primary source of assessment is self-report for pain. There are two pain flow sheets. The first one is a pain flow sheet, which is used for verbal patients, meaning patients who can verbalize, who can cooperate, who can talk, and who can describe their pain. And the other one is a neonatal infant cognitive pain flow sheet, and this form is used for nonverbal patients, meaning patients who are cognitively impaired or neonatal infant patients who cannot describe their pain. For patients who are cognitively impaired or patients who are nonverbal, you have to use the discomfort scale. What you have to do is to observe the patient for signs and symptoms of pain. If more than 3 indicators are detected, for example, patient is restless and with dilated pupil, increase in RR, increase in heart rate. So more than 3 indicators, it means that you have to initiate pain assessment. The difference between the two flow sheets is that this one, the pain flow sheet for verbal patients, has got pain screening questionnaire, because in here, patients can verbalize, patient can talk. And the other one doesn't have initial pain screening questionnaire. There are 4 pain scale tools that we can use. Pain scales are used in order to determine the intensity of the pain. Okay, and in choosing which one is appropriate for your patient, you have to consider the patient's age, chronological age, functional status, cognitive abilities, and of course the emotional status of the patient. So the 4 pain scale tools are numeric, or we call it visual analog, and this is for adult patients, meaning 14 years and above, who are aware and responsive. And the other one is faces, or we call it Wong-Baker. This one is used for 36 months through 14 years of age. Patients who are aware and responsive. And we also have the other one, which is FLAC. FLAC stands for face, legs, activity, cry, and consolability. This pain scale tool is used for non-verbal patients. Patients who cannot verbalize, patients who are cognitively impaired. Can be used for adult patients and can also be used for 7 years or less. The last one is the neonate behavioral score, and this is used for 0 to 60 days old patients. And in here, as we can see, there are 3 behavioral score, of which you have to score with facial expression, body movement, and color. And these can be used for patients who are on mechanical ventilator, attached to mechanical ventilator, or patients who are not on ventilator. Now I'm going to show you how to do the initial pain screening and documentation. Ask the patient if the patient is in pain. Are you in pain?
Yes.
And then ask for the location. Can you tell me the exact part of your body which is in pain? Where is the pain?
Here, at my right side.
And then ask for radiation. Do you feel it in other part of your body?
Yeah, it's like moving and radiating to my right leg.
Okay, it's radiating to your right leg. When did it started?
Yesterday.
And that is asking for the onset. Next, assess for the quality of pain. Sir, can you describe your pain? Is it aching? Is it burning, cramping, or is it pricking pain?
It's pricking pain.
It's pricking pain. So, sir, can you tell me if your pain is constant or intermittent?
It's actually continuous. It's constant. Yeah.
So it's constant. It's continuous. So then, after the frequency, assess for intensifier. Sir, can you tell me what makes your pain worse?
Yeah, if I stand a little bit longer.
And then ask for nullifiers. Sir, can you tell me what relieves your pain?
Yeah, lying on my bed with not moving is the best really.
Oh, so rest and immobilization relieves your pain. How about medication, sir? How did you manage your pain? What did you do at home in order to relieve your pain?
Yeah, I have pain medication. If I cannot tolerate the pain, that's the time I take my pain reliever.
Okay, so that is a management history. And then proceed with asking the patient how the pain affects him. So, sir, may I know how this pain affect you? Does it affect your sleep? How about your appetite?
Yes.
What?
Physical activity, it's really limited.
Okay. So does it affect your emotion?
Not that much.
The next thing you have to do is to assess for the intensity of pain. Our patient is adult, and so I'm going to use the visual numeric pain rating scale. Sir, I would like to know the intensity of the pain you are feeling right now. In the pain score of 0 to 10, wherein 0 means no pain and 10 is the worst possible pain, can you rate your pain, please?
Yes, 4.
So it is moderate pain.
Yeah.
Part of the pain initial screening questionnaire is setting of comfort goal, and you have to set the comfort goal with the patient using, for this patient, since he is adult, for this patient, you have to use the numeric pain scale tool. Sir, your pain score is 4. I'm going to relate this to the physician, and most possibly we are going to have pain management measures. The goal of our pain management is to decrease your pain to at least 0 to 1.
Yes, better.
Patients are educated about pain and managing pain as part of the treatment plan. Patients and families are instructed about understanding pain, common fears about pain medication, importance of effective pain management. They are educated about the assessment process and the methods of pain assessment or pain management. Based on the scenario, this is how to fill up the pain flow sheet, pain initial screening questionnaire. So ensure that you put the correct addressograph, write the unit, the room number, and the consultant's name. So since the patient's pain is currently controlled, so you tick yes. So he said that the onset was yesterday, so it is April 1, 2020. And he said it radiates to right leg, so you write here right leg. Patient's pain is constant, made worse by movement, relieved by rest, medicine, and the management history is taking meds, and the manner of expressing pain is verbal. So the comfort goal which was set by both the nurse and the patient was 0 to 1. And also he said that the pain affect the following: sleep, appetite, and his physical activity. So next, fill up the initial assessment. So you write the date, the time, and tick here because the pain scale tool that we use is numeric. It's numeric, so you have to tick this, number 1. And then you write here the pain score. He said his pain is 4, so you write 4. Next is the patient goal. The patient goal is 0 to 1. Then you write the location using the documentation key. So for him, the location is right flank. So flank is number 8. So you write here number 8. Then he said that the quality of pain he is feeling is pricking pain. So you write letter P. And then because it is radiating to the right leg, so you have to write here R, which stands for radiating. Next, for the intervention, since he came from ER and is on medication, so you write here letter Y for medication. And for the alternative measures, alternative interventions that the nurse has done, so the nurse put on the television for him so that the pain can be deviated. So you write number 9. TV, 9. So we write number 9.